Welcome to the February Alumni Lunch and Learn for the L. Douglas Wilder School of Government and Public Affairs at Virginia Commonwealth University. My name is James Wazalewski, and I'm the Director of Development for the Wilder School. Thank you so much for joining us today. Our session will feature our guest speaker, Dr. William Spriggs, as well as our moderator, Dr. Ben Teresa, for the presentation and discussion, Economic Recovery and the Pandemic. As a reminder, we are recording this session as well as the question and answer portion. This includes comments in the chat. For those of you who wish to enable closed captioning for this live session, please click on the CC Live transcript icon in your Zoom meeting controls on the bottom navigation bar. If you cannot see this button, click on the More icon. From the pop-up box, click the Enable Auto Transcription button. This will allow you to see closed captioning for the live session. We are pleased to have each of you here for our session as we continue our efforts to engage and involve our alumni and our community. At this time, I would like to introduce Dr. Susan Gooden, Dean and Professor at the L. Douglas Wilder School of Government and Public Affairs. Dean Gooden.
Thank you so much, James. And again, I'd like to welcome everyone for your attendance and participation in this session. You know, we started this session, this series directly after the pandemic, and it has become very, very popular within the school and with our alumni. As you all know, for those of you who have joined us in the past, it's a great way to have experts come and join us on some of the most contemporary and pressing topics that we are facing nationally. And certainly we don't have a loss of topics to discuss. I know today's speaker will be formally introduced, but I have the utmost respect for Professor Spriggs. He is a undisputed expert in labor economics and nationally, and is often consulted for his and relied upon for his insightful expertise, particularly in terms of economic implications for vulnerable communities, communities of color, and individuals who are marginalized in society. And as everyone knows, the L. Douglas Wilder School of Government and Public Affairs is very dedicated and committed to social equity, racial equity, and social justice as part of our mission. So this series also is directly related to the fulfillment of that mission. I just wanted to highlight, just for a brief moment, a couple of things that I think are particularly related to the topic today, to say that we have much work that we are doing within the school to advance our understanding of the implications of the coronavirus on the pandemic. Dr. Elsie Harper Anderson has done a lot of work in terms of Black-owned businesses and implications for minority-owned businesses relative to economic recovery. And our Research Institute for Social Equity recently received a new contract to look at vaccination distribution and inequities throughout the Commonwealth of Virginia. So we're very excited about the work that we have going on and the contribution of our faculty, staff, our students, and our alumni in this space. So please join me, and I know what is going to be an outstanding session and that we will all learn a lot. Dr. Spriggs has been a great friend of the Wilder School, and we greatly appreciate his expertise that he's sharing with us today.
Thank you so much, Dean Gooden. My name is Ben Teresa, professor in urban and regional planning in the Wilder School and the co-director of the RVA Eviction Lab, and it's my pleasure to be able to introduce our speaker, Dr. Spriggs, this afternoon. So Dr. William Spriggs is a professor and former chair of the Department of Economics at Howard University and serves as the chief economist to the AFL-CIO. In his role with the AFL-CIO, he chairs the Economic Policy Working Group for the Trade Union Advisory Committee to the Organization for Economic Cooperation and Development, and serves on the board of the National Bureau of Economic Research. He was the 2016 recipient of the National Academy of Social Insurance's Robert M. Ball Award for Outstanding Achievements in Social Insurance and the 2014 NAACP Benjamin L. Hooks Keeper of the Flame Award. From 2009 to 2012, Dr. Spriggs served as an Assistant Secretary for the Office of Policy at the United States Department of Labor, having been appointed by President Barack Obama and confirmed by the US Senate. Dr. Spriggs is a former president of the National Economics Association, the Organization of America's Professional Black Economists, and is a member of the National Academy of Social Insurance and the National Academy of Public Administration. He graduated from Williams College in Massachusetts and holds a doctorate in economics from the University of Wisconsin-Madison. So again, a couple of reminders to all of our audience that this session is recorded and will be archived in the Wilder School website and YouTube channel. And as the presentation goes on, you have the opportunity to submit your questions into the chat or Q&A box on your screen. So please do so, and we'll have an opportunity for questions at the end of Dr. Spriggs' presentation. So with that, I'd like to welcome once again, Dr. Spriggs.
Thank you so much for the kind introduction, and thank you to Dean Gooden for this opportunity to present to you. I am very happy to make presentations at the Wilder School, mostly because she's the dean, and her scholarship helped to spark, I think, a whole movement on racial equity, particularly when it comes to thinking about how policies really work. And I think that was a giant step forward for everyone in public policy schools. And I'm happy that she's the dean of public policy schools so that she can continue to advance that work, both with her students, but also with her faculty. It's a very important time and an important test of our ability as a nation to respond to inequality. This virus has made clear how deep the levels of inequality run in our economy. I want to start with today's headline. Today, the Bureau of Labor Statistics gave out information on the Producer Price Index. This is sort of the wholesale price and is a harbinger of whether we would have coming inflationary policy problems or not. And the buzz is because the index was around 1.4, mostly driven by services. Now, people on Wall Street who love to speculate and gamble, that's the impolite term for what they do. They like speculation. I like that they gamble. Are, of course, all in a tizzy because anytime there's a hint of inflation, they get nervous. They are the people who lend the world money, and so of course inflation bothers them. But this is actually a good place to start a conversation about the path we're on and the challenge to addressing inequality, because you have these competing voices in the public policy space, and Wall Street has dominated for the last 40 years that conversation. Their fears come from inflation. Unexpected inflation is bad if you are someone who lends money. And it gets to an understanding of how the economy relates to inflation and fulfilling the promise of actually producing on the frontier of what's possible for an economy to produce. So oddly, if you lend money, you would think, well, I want the economy to do really well because I want people to be able to pay me back. This is sort of the number one thing. If you want to make money from lending money, people have to be able to pay you back. But it's also true that if the economy is going at a slow pace, you don't have to worry about inflation. So those numbers that came out, the 1.4%, are well below the 2% target that the Federal Reserve has set for US inflation and on average over the long run. And this is important to highlight. So first, Wall Street is upset because the current chair has changed the rules from their perspective, because he's saying to them, I want a 2% inflation rate on average over the long run. They prefer 2% as a ceiling. And so that has given them some heartburn. They currently fear that this new directive that the Fed has will result in the Fed allowing interest rates to remain low for a longer period than they would like. After all, if you lend money, you make money on the interest that comes back. And if interest rates are low, you don't make as much money. So that's their concern. So they don't like what he's saying, and they're looking for arguments to prove him wrong and to return to a regime in which interest rates could be higher. But in actuality, what we face right now is pressures, particularly in the service sector, for deflation, that is, for prices to collapse and stay down, and without having a way to pump the economy back up. So the virus has had the effect of destroying industries that are service-based because they require person-to-person interactions, and those interactions unfortunately lead to spread of the disease, not so much from orders from governors to slow down interaction, but the fear of the disease itself is driving down business. And because there's huge variation in the United States with respect to localities, with respect to states, with respect to industries about what's shut down, what isn't shut down, we get to see, as economists, what's the response. Do we see less business activity being driven because of these orders, or because of the presence of the disease? And it's quite clear in the data, it's the presence of the disease. People are reacting rationally, given that we don't really have cures for the disease. We just have palliatives, and then we pray and hope that you will make it. So as a result, people have real fears of catching this disease, and they're responding to that fear. And so the governor could say, y'all can get on a plane tomorrow all you want. It doesn't mean that everybody's going to rush to get on a plane, as long as the presence of the disease is at a level that frightens people away from hopping on planes, keeps them from going to an arena, keeps them from going to a theater or other live events where large numbers of people have to gather, or having expos, or having me drive down to Richmond to give this presentation live. So as long as those fears are present and they're rational, we can't get the economy going. Those portions of the economy are continuing to be slow in their recovery. We lost 20 million jobs in April, the biggest single month drop, and actually the single biggest drop in our labor market ever. We rebounded some of those jobs over the course of the year. We did that with a lot of push from support by the federal government that helped low-income families, particularly those who had lost their jobs, by making up for that lost income so that they could keep consumption at a high level. But by December, we had gone from July to December without that extra wind behind our sails in the economy. The economy slowed down. We lost jobs in December. January was pretty flat. You actually have to average the two together because seasonal factors are different for Christmas sales and retail sales in this environment. As we've all learned, people are buying things online, and seasonal adjustments that were based on the idea that people would be in department stores aren't as realistic in this environment. So December, we may have slightly overcorrected for a seasonal adjustment on what we thought would have happened on the retail sales side. And in January, it was quite clear that we were off when it came to fulfillment centers, transportation, warehousing, where Amazon lives. So if you take the two together as, okay, what's the seasonal adjustment, given that a lot of people are buying online and not in stores, December plus January, you get no jobs. So we went from recovering jobs to now 2 straight months of flat jobs. We right now are down close to 10 million jobs, which is about 1.5 million jobs fewer than the depth of the Great Recession. So in terms of where we are from a human perspective, that is, do you have a job? Can you support a household? We're deeper in problem range than at the depth of the Great Recession. And again, this is all focused on service sector jobs not coming back quickly enough, because that's the bulk of the jobs that are missing. So leisure and hospitality, which includes restaurant, which is the biggest share of workers, but you also have hotels, and then you have live entertainment centers, and you have other personal services, which are smaller but still important. Nail salons, beauty parlors, barber shops, other personal services, all well below their peak. Every nation is feeling this, though. Another service sector is transportation. And as I mentioned earlier, people aren't getting on airplanes. They're not flying to Disneyland, Disney World, King's Dominion, Busch Gardens. So without that revival, what's going to happen globally? Well, globally, coming out of this, every nation has this same problem. People aren't on airplanes. People are not in hotels. There are no business convenings, no expos, no conventions. People are not vacationing in the same way. And so every nation has a glut in services. This happens to be one of our success stories in the US. We're very good when it comes to tourism. It's important to the state of Virginia, if you are from Virginia Beach like me. And so, as you know, we think of other things as glitz and glamour when we think about trade balances and exports and imports, but tourism is an export business. That's how we account for it. When foreigners come and stay at Colonial Williamsburg, that's an export, because they're providing us with foreign currency that they convert to dollars to pay for those hotel rooms. So what's going to happen? You can pretty well guess that because all national airlines are in a very dire position, that other countries that more directly support their national airlines are going to do everything to continue discounting beyond the recovery, discounting airline tickets in order to get people to get on the plane and to come to their country and be part of their tourism industry and revive their service sector. Many destinations, tourist destinations, are in countries that are low tax and low wage. And you can imagine a real competition taking place that could be a race to the bottom, so that when the world has a better grip on the virus and people feel safe traveling again, that these economies are going to do everything they can to fill those hotels and fill those airplanes. So what we need to fear is deflation in the service sector. So actually today's news that the discounting has stopped in the service sector and in fact gone in the other direction, that is to not only stop discounting, but to make a movement towards normal pricing is a good sign, because obviously these industries can't last for long periods with heavy discounting any more than any other industry could last for long periods with heavy discounting. So today's inflation news is kind of good, but here's where the problem with equity comes in. Economists are carpenters. We look at the world as a bunch of nails and we start pulling out our hammer. This isn't one of those situations for which carpentry is the answer. This is actually a natural catastrophe. It's an exogenous shock to the economic system. It's a shock in which one portion of the economy is severely constrained. And so the way economists normally approach an endogenous collapse of the market, where there's broad loss of income, and we seek through Keynesian methods to pump the economy and re-inflate demand. Well, that's not the case here. We have a portion of the economy that in essence has been wiped out by a catastrophe. So the better analogy to what we're facing would be Hurricane Katrina on super steroids. So if you will remember back to Hurricane Katrina, I, for one, was actually shocked as an economist because New Orleans is a fairly decent sized American city. I was convinced that taking an entire city, which generates most of the revenue for the state of Louisiana, if you took it offline, this would be really bad. It would show up in GDP numbers. It didn't. It didn't. It wasn't even a blip in the GDP numbers. And people made instant adaptation to, well, if we can't go to New Orleans, we'll go to Vegas, or we'll go to some other gambling center, or we'll go to some other adult vacation spot. There are other Mardi Gras. You can go to Mobile. You don't have to go to New Orleans. And we absorb people making these kind of shifts. We even absorb people making shifts in where they live. So, you know, a large part of the population of New Orleans went to Houston, and you can get some of the best Creole food still to this day in Houston because half the people who used to create it are living in Houston. So that's the way economists want to look at this one, but this isn't just one American city. We've lost 500,000 Americans. So that's bigger than the city of New Orleans when you think about the population. And the number of Americans who've caught the disease is far, far greater than that. So we're responding to, you can't have this part of the economy function. What do you do? Economists feel very, very, very reluctant to support people. This is because economists practice a religion. They like to think that they're scientists, but they actually practice a religion. So they see a moral imperative that if someone loses income, you not give them money because they fear that that you're going to create this this attitude towards handouts, and that will remove the enforcement of the market mechanism and induce people to be lazy. And so as a result of that, they feel very reluctant to help people, even in a situation where you know from common sense, obviously people are going to need help. There's no way to reallocate every actor on Broadway, every lighting director in Hollywood, every sound stage manager at a rock venue or jazz club, every restaurant worker, every hotel. There's no place to put them. And further to the point, you wouldn't want to, because when the virus is gone, or in the case of New Orleans, when the water came back down, what are you going to do if you reallocated all the resources that would let you bring the city back? And we're faced with that same difficulty. If we reallocated all of the workers out of these industries. Let's train them. They should all be computer programmers. Fine, what are you going to do when the virus goes away? And people say, I want to go to a restaurant. So people haven't thought this through. Economists are, beyond being stupid. So the challenge we have is for economists, this sign of inflation from this morning is readily going to be interpreted as, oh, we don't need to do anything because look, the price level is coming back. Even though we have over 10 million people without jobs, we need to worry that the economy is actually growing too quickly. You're going to hear that. The other thing you're going to hear is we don't need to continue to add money to unemployment benefits. Now, this has been the most disheartening for me personally in this debate. If you're Black or brown and a disproportionate share of the workers who are affected by this downturn, not because of skill, but because of the industry in which they work, disproportionately they are in the restaurant industry, disproportionately they work in hotels, disproportionately they work in personal services as barbers, beauticians, nail salon workers, whatever. They have no wealth. And so as a result, when an unemployment spell occurs, they aren't like other households that have wealth and liquidity. If you lose your job, it isn't like, I have $600 in the bank and that'll tide me over for a week. And so when you give me an unemployment check, I figure I'll be unemployed for maybe 3 weeks, 4 weeks, 5 weeks. So the unemployment check allows me to think, maybe I can consume. I know I have a little bit on the bank. I'm okay. If you have nothing in the bank, then you understand the moment this unemployment check is gone, you're in big trouble, not little trouble. You're in angst level trouble because you can't pay the rent. You can't pay the light bill. You can't buy food. You're facing life or death. So giving you extra money to your unemployment insurance is not a disincentive. It is not, well, I'm not going to go to work because I got this extra money. It is better for me to be getting an unemployment check. You fully understand these checks aren't forever. What economists don't do is because of our training, when you write out the equations as an economist for the search models that are the basis for economists saying you don't add money to unemployment checks, when you write out those equations, we as economists put in this thing B. This is the benefit you would receive or the income you would receive if you weren't working. Well, yes, if I have wealth, if I have some savings, then there's something for me to fall back on. B is not zero. So when I don't have a job, I have something coming in. These aren't people where B is a positive number. B is zero. In fact, for many people, B is negative because they're in debt. So if they don't work, the debts just mount. Second, when you write out these equations, economists know that part of the function is what's the probability I will exit unemployment has to be part of the function. So whether I accept a job offer or not, it's based on what would I get if I don't work, but also what's my expectation that I'm going to get a job again. But what economists don't appreciate again is that for many people, B is negative. Most people who have low wage jobs actually are trading water. So in a normal economy, they are trading water. The only way that they survive is because they can see the shoreline and they're optimistic enough that if I keep trading, maybe I can make it to shore. Maybe someone will come along in a boat and pull me into the boat. So they're willing to keep trading water. But imagine you're trading water and it's a hurricane. You're not in 1 or 2 foot waves. You're in 10, 12 foot waves. and it's dark and you don't see the shoreline. This is not the same thing. And so what economists want to do is say, well, why don't we just return them to trading water? If I give them unemployment benefits, then that should be enough, because then they can keep trading water. You can't trade water in a hurricane. And so when you give someone a check in this moment of a hurricane, when this is April, we're now in February, almost a year where we have fewer jobs in our economy than at the depth of the Great Recession. Not when the economy is, 10 jobs short of full employment. It's millions of jobs short of full employment. You cannot see the shoreline. It took us 10 years to get back to normal employment levels from the Great Recession. A rational person in this job market would think, I lived through the Great Recession. That was 10 years. So right now where I'm sitting, my money better last me 10 years. I'm not going to volunteer to be trading water. If I can get a job, that's the little boat that I get to hang in. So the idea that economists have that, oh yes, this is, a moral hazard. We call it a moral hazard. Remember, I told you they're religious. They're practicing a religion, not Christianity. So this moral hazard that, you don't want to incentivize people to be lazy. And this situation, it's incentivizing people to do what you would hope they would do, which is to go back to consuming. I got to put you in a little boat in the middle of a hurricane. The extra money that we added actually provided that sense of confidence that allowed people at the bottom of the income distribution to consume. In a normal downturn, facing normal unemployment benefits, consumption at the bottom collapses because people are fearful, and they understand that when they got the little bit of money they have to hold on to it and stretch it as far as they possibly can. They don't help to revive the economy. They are in the extreme of trying to save their lives. What I fear is you get news like today, and we're going to get more news like that as we get the disease under better control. And as the economy starts to reopen, there are enough households with excess savings that there are enough Americans who could flood back to the airlines, get that vacation they would love to take this year, and go back to a place where we can rehire people. And at that point, you're going to hear the sounds go through the roof. Why are we doing all of this? Why are we helping these people out who got put into this dangerous water? Why are they complaining? They should just go back to trading water like they were before. And that's the other suspicion here, is you're getting a complaint from economists. You're actually wanting to run a different game on this. You want to save these people, but what you really want to do is get them from trading water. So what we fear is these won't be temporary movements, that you'll continue to insist that when we have economic downturns, that we help people at the bottom, people who have no wealth. This is very disturbing to me, because as much as people want to argue about, no, why do you need reparations? It's because when common sense would tell policymakers, we understand these disparities, we understand they create different difficulties and challenges, and we're prepared to address them. Instead of that, what we have gotten is, yeah, we know there are disparities, but y'all just need to train. That's the disheartening part, which makes you go, well, look, if there's going to be no deal, there's going to be no recognition of the impact of inequality on people's lives, and you just don't tell me drown, then please just give me my reparations, because you're not prepared to address what inequality means, which is the other thing. people get into this price tag thing. That's too expensive. Why should you be giving them, so much money, or why should we be spending so much money? This is the cost to the economy of inequality. Otherwise, as we saw in December and January, without this extra amount of money, we generated no new jobs. The economy totally stalled out. And there's this inability in the policy space to really want to respond to it. And my fear is, while the president's American Recovery Act is designed to help recover in those sectors where we know people are not working, where we know that they can't get employment, where actually we really don't want them to work because we don't want to have all of these super spreader events or super spreader locations that make it harder to solve getting the virus under containment. This lack of willingness to take on this challenge and what it really means, even in the face of the data we had in December and January, that without this extra support, we can't generate any more jobs. The economy generated no new jobs in December and January, absent having already pumped a lot of money into low-income households. So that's, to me, the danger. We're going to get to September or October when hopefully the viruses are under far greater control. Hopefully the Recovery Act will have passed. We will have gotten much more vaccine by having a president who actually does what he was supposed to have done for the last 4 years, which is pay attention to the United States, but have a president who actually uses the Defense Act to pump up production of the vaccine. We get everybody vaccinated. So far, we're already on pace, even with this very inefficient way that we've been proceeding, to meet the president's goal of 100 million people vaccinated within the first 100 days. And it looks like we're going to go way beyond that. Later, we may be able to get to the 700 million, 700 million, not 100 million people, but we'll get up to that 70%, 80% share of the population who have been vaccinated, and people feel more comfortable. We'll get to September or October, and people will feel that they can safely attend large gathering places. People will feel they can resume in-person business. And at that point, the conversation, I fear, is going to turn very nasty, because people won't understand the 1.5 years lost in income, not just because of lack of jobs, the loss of life. Economists don't do a good job of estimating and valuing what this has meant to millions of American families. 500,000 people dying still means millions of families have been affected by the loss of life. And the millions of Americans who lost work time because of the disease, and we don't know all of the debilitating conditions that those workers may face as they go forward. The rollout, unfortunately, because we totally ignored this as a disease transmitted at work by workers who could not be at home, meant that we missed excess deaths occurring in specific occupations, which were way overrepresented by Hispanic workers, Black workers, Asian workers. So often we do racial stereotyping and think of Asian workers as all, computer engineers, and that's not true. There are many low-wage Asian American workers, and they engage in personal services, restaurants, nail salons, other personal services. And as a result, if you look at the data in California, healthcare workers who are Asian Americans had an excess death rate far above what we would have expected. And this impacts households greatly. So, and it's something we don't do a good job of modeling as economists. So my fear is if we pass the Recovery Act sooner rather than later, we will have the money and the resources to address getting the vaccine out getting our schools open safely, and we will have kept low-income households intact enough so that when September and October reach, restaurants, hotels, and those service sectors will have workers who will be available, can be rehired, reabsorbed into the labor force, but we're going to face this instant pushback for this fight for equality. I've gone way over time, but I want to hand it back over to Professor Teresa, so so you can get to ask some questions.
Well, thank you so much, Professor Spriggs, for some really interesting remarks and stark reminders about where we are in the midst of the pandemic and economic recession. So I'll just remind the audience that now is your opportunity. If you do have questions, please drop it into the Q&A. And while we're waiting for additional questions to come in, I might start us off by posing one question, which I think kind of ran throughout your remarks here. If you could kind of talk about, or how should we think about the differences between economic survival, right? We need workers and people to be able to, especially those who have lost jobs, just to survive through the pandemic, and then other policy measures to recover. Because I think there's discussion about, one-time stimulus payments. Are those really stimulus payments, or are they survival checks? And then other measures that have been proposed alongside Biden's, economic recovery package, like the minimum wage. How should we think about minimum wage debates in this two-sided, two phases of survival and then recovery?
So a lot of people don't understand our unemployment insurance system. The vast majority of workers who are in the leisure and hospitality industry don't get unemployment in a normal economy because they don't qualify. Their earnings don't meet the earnings test. And I work among economists who model this. It is impossible to accurately run our models because the eligibility requirements are so Byzantine that you cannot possibly make sense of it. Your earnings must be a certain level over the highest quarter over the last 2 years that you worked, unless you didn't put enough hours in over the last quarter in which you worked. You have to pull out a computer to actually figure out who can get benefits and who can't. Most workers, if you make the minimum wage or close to the minimum wage and normally work part-time hours like most workers in hotel or in restaurants, you don't qualify. And these formulas are Byzantine and they're hard to figure out, but the bottom line is you don't qualify. So without the pandemic unemployment assistance, most of them wouldn't get any unemployment insurance. And so if you don't add money to the PUA, the pandemic unemployment assistance, if you don't add money to the PUA, they get virtually nothing because their records aren't high enough, their earnings records aren't high enough to warrant what would be a normal unemployment check. So they don't even get an average unemployment check. So in March, these things run out. In December, when they ran out, the problem is our state unemployment insurance systems don't have PUA written into them. We operate with systems that are ancient, to be polite. Everybody knows the whole debate about, well, why couldn't you just change the formulas in the computer? But they've written the computer, honest to God, their computer code is written in COBOL. COBOL is a language that, we taught schools and schools of businesses back in the 1970s and 80s. You have to go find somebody in a museum, or you got to search real hard to find anybody who knows what COBOL is. They got to go on Google, like, what is COBOL? Nobody who graduates in computer science today could write you a COBOL program. That's how ancient it is. I mean, we'd be like, I want this text written in ancient Greek. It's like, okay, that's fine if, you went to a classical university and you took classics, but that's not how the world works. So this is the difficulty we have in continuity. The state stopped, and now they had to restart the PUA, and just as they're restarting it, we're telling them it's over in March. If you don't renew this right now, then they're going to cut it off, and then they got to restart again. A reason for the blank check, here's $1,400, is because we know there are these gaps. We know that there are people who don't get reached by the unemployment check, or it takes them months, literally months, to get the first check. We've overwhelmed the system. And most of these state unemployment insurance systems had very few employees. And at the federal level, the US Department of Labor, even though that's the biggest single budget item in the Department of Labor is unemployment insurance and the Unemployment Insurance Trust Fund, they're like 8 people. Not nearly enough to handle big transformations in the program, how states are to react, the creation of new benefits, the PUA benefit, the pandemic unemployment emergency payment, the extra $300, $400, $600 that gets added, the extension of the benefit. This is too few people to solve a tremendously big problem. And so that's why the payment was necessary to get to the people who fall into these cracks that actually, in the case of the unemployment insurance system, are more like the Grand Canyon. The point of the minimum wage, as much as people are making a big deal out of it, like we're going to make it $15 tomorrow, it phases in so that we are in a movement towards $15 an hour. And here's the big problem. We have this huge, vast number of people unemployed who have built up huge arrears. They're in debt to everybody. And we're going to flood them back into the labor market, we hope. We're crossing our fingers and praying, in September and October, with very little and actually no leverage in the labor market on their wages. So as the economy expands out of the pandemic, the problem is going to be, where's going to be the pressure to see wage growth as the economy expands? So if we don't already bake in what that expansion will look like when it comes to wages, then we're guaranteed that the recovery will not be as robust, because the wages just aren't going to come back. The big problem we had from the Great Recession was that wages never really came back. They were very flat. The only movement we saw in wages from the recovery from the Great Recession, remember, it took us 10 years to, it was only 2018, 2019 when we were fully rebounding in terms of employment, was because in that interim, over that 10-year period, state and local governments began to say $7.25 is too low. And we saw a massive movement within the United States to raise the minimum wage. Only in those places where we were raising the minimum wage did we see wage growth. And it was all at the bottom. So if we just sit back and say, oh, there's going to be an expansion, everything's going to feel good again, and the economy is going to recover, it's going to recover without wages. So we need the minimum wage. We need to agree to that now, so we understand the shape of the expansion that will take place, let's hope, by October. And again, remember, this is phasing in the minimum wage. This is not October 1, everybody's going to get $15 an hour. It's phasing it in so that as we expand, we can be assured we will not have a wageless recovery like we saw during the recovery from the Great Recession.
Thank you. I want to now, turn to some of our questions from the audience, and I might be able to, in the interest of time, combine a couple of these together. So I think we had a couple of questions that relate to what you see as long-term implications, long-term changes, both in the economy and maybe in terms of what policy will require to meet those changes in areas like the labor market. So a huge, as you pointed out, a huge chunk of our labor market evaporated over the past year. What are the implications going forward for the structure there? And another question kind of touches on, what do you foresee as longer term for how we handle healthcare? Of course, a big component of this pandemic economic crisis.
Well, I am hopeful that we don't listen to economists when it comes to the jobs, because we just love to reallocate people. This is, frictionless. People just switch jobs, and, we have startups for coder school and everybody becomes a computer programmer. I hope that's not what we see. We have not put together all of the components of what we've lost. And I think, the great thing about the concentration of the Wilder School on urban governments and urban affairs will help remind people of this, is we only saw cities recover because of the restaurant industry. We tried everything. People in Richmond know Richmond tried everything to get people back downtown when Tallheimers and Miller and Rhodes and the other big department stores downtown went away. And, you had the revival, you had that marketplace downtown, and nothing seemed to work until finally, so you got this organic spread of very successful restaurants, you got foot traffic downtown, and that put people back downtown, and that allowed stores to open, because after you shop, then you can go, after you eat, you can go shop. And so if you say, well, I don't care about the restaurants, then okay, well, what's your formula? What's going to get people back downtown Richmond? We already tried the other things. So what do you think is going to work? This is a challenge. Economists don't try and worry about that, because the ones who are mouthing off about this don't worry about like urban development, actual micro level issues like that. And a misunderstanding, because these workers aren't high paid, that they're low skilled, which is, the other sin of economists. We economists place value on human beings. And trust me, if you ever hear an economist say, your job is low skilled, that means do this. You need to duck and cover, because it's coming at you, because they feel you deserve to be punished. And anything we throw at you, it's okay, because you're not even part of our discussion. You're worthless. And so the hopefully, because everybody's been at home, they have a deeper appreciation that a lot of things that people do that are low wage are really high value. Like everybody who is sitting at home, who thinks that they can bake bread, who thinks that they can make the best Italian food or the best Greek food or whatever, hopefully they've all convinced themselves, I probably can't do that. And then there are all those parents who are now learning that watching your 3-year-old is not as easy as you think it is. So I have deeper appreciation for childcare workers, for restaurant workers. We won't think they're just low wage workers, but if we don't see people come back to these restaurants, all of these inputs that we have not cataloged very well as economists also fall apart. Most of these restaurants are farm to table. There are a whole host of local farmers who provide the vegetables and other things that make this cuisine that we have now adopted as Americans to be very popular. There are seafood purveyors in Virginia. The bulk of seafood, fresh seafood, is consumed in restaurants. People don't tend to cook that much seafood at home. Even people from, the Bay Area, it's not the most common form in which we eat it. Raw oysters at home is not that common, but people do eat them in restaurants. So it's a challenge if we don't have it come back. Now, economists want to say their jobs will be automated. Those aren't the restaurants that revived our cities. McDonald's did not revive our downtowns. Red Lobster did not revive our downtowns. The places that automation might augment what the servers do or augment what goes on in the kitchen. Those aren't the restaurants that revitalized our cities. And if you take away the meal tax, if you take away the occupancy tax, this is a huge chunk of revenue for local government. So you got to figure out what's the replacement. So this isn't just figuring out what happens to the workers, it's also figuring out this ecosystem that we created and what's the substitution. Here in Northern Virginia, for instance, Amazon, of course, wanted tax holidays. Restaurants don't get tax holidays. Restaurants pay taxes. So people say, we're all going to do this with coding and with Amazon. Remember, Amazon cost you tax revenue. So you can't solve the problem by just saying they switch over to Amazon, because then you have a whole nother problem about where does the revenue come from to sustain the model. I'm sorry. I got off on the workers and you had asked the second part of the question.
The second part had to do with changes in healthcare, sort of longer term implications.
And healthcare. Yeah. Well, I think this is going to be the challenge going forward. President Biden has stuck to, he just wants to reform the Affordable Care Act. But for this prolonged period in which people have lost jobs and are separated from their employer, we have within this Recovery Act COBRA payments to help people continue with their employer provided health insurance. But for people who went through this downturn, there was a lot of employment, lose a job, employment, lose a job. And the problem with the Affordable Care Act is I lose my job, I can apply for Medicaid, but then I get my job. And, you know, this complication of going between Medicaid, the exchange, employer provided healthcare in a dynamic market is complicated for people. And then add to it, they're going to the hospital. And add to it that COVID care is exceedingly expensive. I'm hoping that there's enough pressure politically for people having gone through this that we'll end up saying this complicated system is too much. We have to have a system that is far more rational. And we will see the logic of why you need a single payer system, because this is too complex, what people are experiencing. And rural hospitals are deeply challenged in this environment. And what it will take to maintain rural hospitals coming out of this, hopefully we'll see that we have to rethink competition within the hospital space. We have let competition monitoring go away in hospitals, and we've had massive consolidation that has destroyed competition, but also viability. We haven't worried about viability, but we need to worry about viability when we look at our rural hospitals. So for Virginia, this is a catastrophe that's taking place because the rural hospitals have been stressed by this, and taking away the cross-subsidization that the urban hospitals did has put them in trouble, because the elective procedures where hospitals have engaged in cross-subsidization to make themselves viable, that's kind of gone away too. So the exposure of this cross-subsidizing between some of my patients, I can get a bigger reimbursement from this healthcare plan, so we charge a lot of money for that, and that cross-subsidizes the care that we give that's predominated by Medicaid patients, where we get a low rate. I mean, this is what hospitals do, and this is how you get these weird stories of, why does this procedure cost, $18,000 at this hospital, but $300 at this hospital? It just depends upon how they maximize the cross-subsidization that's necessary. And the consolidation has been a result of you got to be big enough to do that. And this is not a way to run a healthcare system. I'm hoping that all of this having been revealed to us, someone will go, this is stupid. Why are we doing this?
Well, thank you so much for those insights. We're right up on past the hour. And so I want to thank you again, Professor Spriggs, for your time today. You've left us with a lot of important things to think about and to follow. So we'll be interested to follow the conversation and hear from you again in other ways over the coming months as these issues continue to be pressing for Virginia and for the country overall and the world, as you pointed out. So I'd like to thank you again, Dr. Spriggs, for your time, and James Wasilewski will close us out. Thank you.
And thank you for the invitation.
Absolutely. And thank you again, Dr. Spriggs, Dr. Teresa, for moderating this session. The Q&A, those are some amazing questions. That was a great. And Dean Gooden, thank you so much for this awesome session and also well as the discussion. And also a wonderful thank you to all of our participants for today's session. Thank you so much for your time today and for being here and being curious and asking those questions, a commitment to public service. We hope you will complete the survey evaluation about today's session. This includes suggestions for future topics for upcoming Wilder School Alumni Lunch and Learns. It helps us learn what you want to hear about as well. A recording of the session will be made available on the Wilder School YouTube site or channel, as Dr. Teresa mentioned earlier. We will also be sharing this with all of our participants and all those who register for today's session. So you will have that in your inbox within the next week or less. Our next session will be on Wednesday, March the 17th at noon, featuring Dr. Norman Oliver, State Health Commissioner for the Virginia Health Department, with Dr. Jim Burke, the Director of the Performance Management Group at the Wilder School, as our moderator, with a discussion about the COVID-19 vaccination efforts, as well as accessibility and more, followed by another Q&A session with our participants. As a special note, we do have another special event coming up for our participants to note. Please remember to save the date and register for our upcoming Excellence in Virginia Government Awards recognition program on Thursday, April the 15th at noon. This year's event is virtual and open for the community to attend. We will and have provided a link for this in the chat, as you will see. This program celebrates the significant contributions and successes of individuals and organizations in the public and private sectors that have created positive impact and elevated our citizens, government communities across the Commonwealth of Virginia, including honorees such as this year's Lifetime Achievement honoree, the Honorable Robert C. Scott. Thank you again for joining us. We hope to see you again very soon, and we'll see you in March.